You want to make sure that what you're doing is actually working. Not only do you feel better, but in black and white. This is really cool because then you can actually show it to your family, friends, and your medical doctor.
Hi, I'm Dr. Sheehan from Sheehan Natural Health Improvement Center, and this is a video for the Nutritional Blood Chemistry Study Group. We'll probably make this available to everybody though, patients, non-patients, practitioners alike, because this is such a stunning case, and I think it's really important to get this information out there, even if it causes people some stress and controversy. Anyway, as you know, we've had a lot of people come down with sudden problems with their cardiovascular system. I've had a number of them in my office. And we had one that actually, this is a 45-year-old male who was diagnosed with heart failure. He was told that he needed a heart transplant. He needed to get on the list. He was put on complete disability. And his mom actually brought him in because she had had chronic Lyme's. She's still having some chronic issues with Lyme. Sometimes if it's been there a long time, it tends to have trouble completely going away. And his stepdad also had a problem with heart failure. Anyway, and his stepdad was able to get off disability with our care. So they brought him in, and I will tell you that he actually seemed a lot worse than they told me. I was expecting someone to have some problems, but he was literally passing out on the table. He couldn't really sit up or stay conscious. And if I didn't know better, okay, I would have thought that he was actually almost faking it, because it looked like he kept on like nodding off and stuff like that. And I'm like, well, what the heck is this? And I was like, this guy isn't paying attention. I was like, oh, he doesn't have oxygen in his brain. Also, when I looked at his previous labs, they were actually not that bad. So I'm the one that actually found all this stuff. So let's get into his case. Okay, the way to get started is quit talking and begin doing. For all you practitioners out there, we have the Nutritional Blood Chemistry Study Group. Get on there. I put all the information that you need to start. If you want any of my pre-printed seminars, Benjamin Wigden at Standard Process East has them. Just call him up and be like, hey, Benjamin, I want these slide presentations, and he has books on them. There's a couple hundred slides. I think the last one we did for them was like 400 slides or something like that. It was pretty big. Anyway, but I have all the information there. But I have simplified it. And so you can start doing it on all your patients. Please start doing it on all your patients. In fact, I would make it mandatory. If you're a nutritional practitioner, alternative medicine practitioner, whatever you want to call it, I would do the template that we have. I would do it on all patients. I would not cherry pick and say, well, this person doesn't need it, because you will get stunningly good results, and you will find stunning cases sometimes, which is very, very important. Okay? Okay, so this is KM, 45-year-old male. I think he might have been 44 when he first came in. Heart failure diagnosis, in need of a heart transplant. He had fatigue, passing out, and low blood pressure. He was sick. Okay, he's about as sick as they come in here. He was able to walk in the door. I've had people that couldn't walk in though. So, okay, so this is the case study submission form. This is the one that we ask all our practitioners to fill out, so we know a little bit more about them. Section 1, please provide a chief complaint. So he's a 45-year-old male, fatigue, lightheaded, and passing out. Heart failure diagnosis. This is a medical diagnosis. I did not diagnose him. We do not do diagnosis here. We do nutritional blood chemistry analysis that helps us help our patients. In need of a transplant and low blood pressure. Section 2. We were going to go over the OptiCardio Plus with B12, folate, and food sensitivity screen. By the way, if you are a practitioner, you haven't done this, do it like, I would urge you to do it like that. If you are an advanced practitioner, has their own panel, I would add in the things that we have here, especially the food sensitivities. We have a very shortened food sensitivity panel because we want to test everybody, because sometimes you see shocking things. We did not see that with KM, but we have seen it with other people with like long COVID. I've seen a lot of people with long COVID, and that's actually a big part of it, is they have food sensitivities. Who knew? A little bit of an aside, we will see lots of pronounced food sensitivities with people with really bad infections, primarily like Lyme, yeast, some of the streps, some other viruses and stuff like that. You will get kind of like a broad-based immune system reaction that causes your body to actually look at food as an immune stressor, and then they never get better. I was a case like that. That's why I tell you, do not skip that. Okay. And also, if you're a practitioner, please submit your cases with the name blocked out. Okay. Anyway. Attach the first page of the 13 area cheat sheet. We're in the process of changing that to the 3 essential areas and then the 8 accessories section. We'll fill that out. We have it on the Nutritional Blood Chemistry Facebook page. What is your nutritional impression of this patient? Or just name the top 3 areas of nutritional stress and balance. When you're going through this, I look at this and say, what on this evaluation would cause his problem? Okay. He was diagnosed with heart stress. Okay. If you look at his blood test, it's important to see, because when you look at his blood test, it looked actually more like he was in liver failure. But he's got he needed a heart transplant. Well, you will see that if you are in heart failure, it will actually put more stress on the liver, and it'll make your liver enzymes go up, inflammatory markers go up, that kind of stuff. And that's actually what happened to KM. Also, interestingly, he did not have a huge amount of immune stress, but that's exactly what the problem was. He had kidney stress. He told me that they actually put him on water pills to get his blood pressure, or to get his fluids down so his blood pressure would come up. So he was actually he looked like he was starting to go into kidney failure. Okay, that reversed very, very quickly. Mild anemia and elevated RDW. Okay, when you see something like that, think somebody with an infection. Okay, especially with huge inflammatory markers. Monitor blood sugar stress. When you think of a patient, okay, think of what would do this. If someone all of a sudden comes in and they can't get up, think of some kind of infection. Okay, that is common sense. Anyway, if you see a person all of a sudden come in and they have, like, they're good one day and the next day, boom, something happened, what will do that? Infection. Whether or not it shows up obviously on the blood test. And if you don't see it on the blood test, we have ways. What we do is we look at inflammatory markers. If those markers are off the charts, you know what causes really bad inflammation? Blood sugar, food sensitivities, and infection. Okay, food sensitivities will show up mainly with the food panel that we have. Blood sugar with the blood sugar panel. Okay, we'll go over that in a second. But infection, sometimes, if it's bad enough, okay, will not show up in the white blood cells that much. Remember that. That's very, very important. Your body will have an inflammatory marker or inflammatory response to it. In fact, that's probably what gives you all the symptoms. Okay, so remember that. If this person has huge amounts of inflammation, not pronounced blood sugar and food allergies, think infection. Okay, anyway. So, he looked like he also had some thyroid adrenal stress. That was because he was dehydrated, because he was on the drug. I won't go through what drugs he was on. I will tell you exactly what supplements I gave him. I do not want this information to be blocked in any way. Okay? And I don't want a reason, give anybody a reason. Okay? So 1, I did not tell him to come off any medication. I repeatedly tell him to go back to his doctors. I did not diagnose him. He came in with a diagnosis. I'm just reporting what we did and how we did our nutritional evaluation. Okay, so what was nutritional intervention? Okay, he was, if you've been following my work, we put him on the phase 2 diet, which is because his fasting insulin, I think, was around 8. He didn't really have that big of a blood sugar problem. That was not it. He actually was not eating that much at all. He had lost like 30 pounds, which is also a very big red flag. We put him on the VRMs from Systemic Formulas. As most of you know, okay, I love Standard Process and MediHerb. In fact, they are my #1 nutritional love in the world. For some reason, we use VRMs. Instead, I had been into the VRM kick. And these are basically antiparasiticals, VRM2 and VRM4. ACX, which basically, as you kill the stuff off, it cleans out the garbage. Later on, he asked to be put on turmeric, NAC, and Silymarin because he could actually feel his liver being swollen. Okay, so keep in mind, between visit 1 and 2, okay, we only had him on VRM4, VRM2, and ACX. It's important to know. That means that the majority of the results are from killing something off that is invading his body. Remember that. Okay. Okay, so let's look at these lab tests. I will tell you, I did not know they were going to be this bad. And I called him up after this, and I was scared. I was actually calling him up because I was going to tell him, hey, you know, if you feel any worse, you got to go to the ER because you could die. These are some horrific numbers, some of the worst numbers I have ever seen. Other doctors out there are listening to this. Maybe you've seen worse numbers. They are horrible. Okay, his glucose was off. Okay, HA1C was off. Interestingly, his fasting insulin wasn't off, so he didn't really have a blood sugar problem. This is more of an artifact. In other words, it was kind of like, because his blood chemistry was so messed up, it looked bad. His BUN was up. As most of you know, BUN, creatinine, GFR, they're markers for kidney. That was because of the fact that he was on, what do you call it? Water pills. And so they were basically dehydrated. He was told not to drink water. That was the same thing that was happening with the sodium potassium. Sodium is low, potassium high. By the way, if you follow my work, this is a sign that the person is in low adrenal. Maybe you could say almost like hypoadrenal. That will happen as your body is trying to fight an infection. It will actually decrease adrenal output, especially cortisol, because cortisol is an anti-inflammatory, but it basically suppresses the immune system, as we all know. And so, you know, prednisone is like a drug that's more long-acting. That's the reason why they use it, because they actually want to cut down the inflammatory thing, inflammatory process in the body. So you can see that's what his body intuitively is. Your body is incredibly brilliant. That's what it was doing. Chloride follows sodium, so that was low too. His calcium was really low or really high. Once again, that's because overall his biochemistry was really off. Magnesium was high, dehydrated. Albumin 6.1. When you see albumin like this, it means, hey, this person's dehydrated. That's a blood protein. The only thing that'll really do it like that is dehydration. He was pretty dehydrated. What else? This is where I got a little scared. I want to be honest. KM, if you're listening to this, you have done awesome. KM's mom and stepdad, you have all done a great job in helping him. Anyway, because this took a real trooper. As LDH, AST, ALT, and GGT, as you know, we tend to look at these as liver markers because that's mostly what elevates them. However, they're actually non-specific. They can be elevated with other things. One of the primary things being is heart failure, heart attack too, I think. Once again, I'm not a cardiologist, but when you look it up, that's what it says. If you look here, his iron numbers, the TIBC, UIBC, iron, and iron saturation, they weren't really that far out of normal. But look at this ferritin. Ferritin is 4,000. For optimum health, it should be below 100 for a male. His is 4,000. That's off the charts. Now, as I go through in my lectures, ferritin is a dual marker. It's not just a marker for iron storage. It's also a marker of inflammation. That's why his was so high. Okay? That, point me out, what will do that? Okay? An infection will do that. Infection, severe blood sugar, severe food sensitivity, but infection is the one that will raise it that high. You'll see when someone has like a blood sugar problem, you might see that near 200. If they have a really bad food sensitivity, you might see it near 200. If they've got some kind of chronic inflammation infection, you can see it 400, 600, something like that. His was 4,000. Anyway, cholesterol is also high. And people would say, oh, he needs cholesterol meds. Cholesterol was not what was going to kill him. That infection was. His HDLs were also high. His CRP, once again, inflammation. Is it off the charts? No. Is it too high? Yes. And what causes inflammation? Okay, I don't want to sound like a broken record, but I will. Blood sugar, food sensitivity, and especially infection. And we're going to go over his food sensitivities and blood sugar. Not that bad. As you can see, that homocysteine, that was also off the charts. That's a dual marker for inflammation, but actually a triple marker. It can be inflammation, non-specific. It's also for kidney, and it's also classically, we look at it for B9 and B12 status in the body, even B6. But when I saw that, the homocysteine, CRP, GGT, and I'm like, there's some kind of infection going on in this person. Why? His thyroid, he was also looking like his thyroid, a little bit hypothyroid, but his T3 uptake was high. That was basically, remember I said he was a little bit hypoadrenal? That's because his hormones were all off because he had that infection. That will happen. It will disturb what's called the HPA axis, the hypothalamus, pituitary, adrenal. You can put thyroid in there as well. Okay. Oh, by the way, remember I said blood sugar? Insulin, 8.2, I think it says there. A little small print. Okay, we'll go through the CBC with differential. Classically, I was taught to look for an infection on the CBC with differential. Not that bad. White blood cell 6.3, normal. Neutrophils and lymphocytes. Neutrophils, they're a little bit high. Lymphocytes are a little low. Nothing to write home about. I was like, whoa, wait, those platelets are really low. Something's disturbing his blood cell production. Okay. Also, RDW, red blood cell distribution, but that was way too high. I was like, something is disturbing here. Something's causing a problem in his red blood cell production. And here we have the food panel that we go over, and we have the B9, B12. And he's a little bit low in folate. That's not going to cause his problem, but you should give him some folate to get him better, which honestly, I don't even know if we did. I think I told him to eat some high folate foods. We'll just retest him. I mean, it was obvious infection when we looked at him. Okay, so when we look at this, he should be avoiding wheat. He should be avoiding gluten. I'm like, KM, stop eating wheat. And he's like, all right, but that's not what fixed him. Anyway, okay, the 3 essentials and the 8 accessory key area worksheets. Write this out as key to learning. I will tell you, I don't write them out in every case. The first couple hundred, I would say, I don't know, first 500 to 1,000 labs that I reviewed, I did a worksheet for every single person, okay? And then I was able to look through it and see how things function very, very quickly. It takes me about 5 minutes to do a lab assessment now. Okay, so number 1 is blood sugar. He has moderate blood sugar stress. You can see his fasting glucose was high, HA1C was high, fasting insulin was a little high. Nothing to really write home about. When you see these two high but fasting insulin low, it means that something else is going on. Okay, and when you fix that, and it did, it went back to normal. Immune function and inflammation. This is the one that's like, whoa. All right, stop, take a look. All right, neutrophils a little bit high, lymphocytes a little bit high, platelets were really low, globulin was low, ferritin was astronomically high, CRP was high, homocysteine was high, his cholesterol was high. That means that basically he had something causing inflammation in his system. Okay, and his body was not recognizing it properly as an infection. Okay, when you have like an acute infection and your body knows it, your white blood cells are going to be high. They're going to be like over 10, maybe over 8, 10, 20. I've seen it like that. His were not. Okay, so his body didn't know what the heck was going on. That's how I interpret it. Okay, sometimes you'll see with chronic infections, and I remember reading a lot about Lyme's, the person's immune system will not recognize it until you actually, like a person would take drugs for it. Okay, I have seen people, my second worst case of parasites that came in here, they drive all the way from Missouri to come in here, and it was obvious that parasites were his problem, and we started giving supplements, and he was breaking out in rings, and he had severe digestive, I mean, very obvious. And his, the classic marker for looking at parasites is what's called eosinophils. They were not raised. However, after he started coming into our office, they went pretty high. They went up to like 9 or something like that, which is too high. So in other words, his body was like, hey, no, I know they're there. Interestingly, he had no more symptoms. Okay. Digestion, absorption. His BUN's high, chloride's low, globulin's low. His IgG sensitivity to wheat and gluten. So in other words, he's got a sensitivity, and he should avoid those foods, but that's not what's going to get him better, but it'll help him get better quickest if he avoids that. Okay, so the accessory parts, iron saturation, a little bit high. Ferritin is sky high, that means it's inflammation, it's not iron. Okay, iron functionally high, high ferritin due to inflammation. Vitamins, minerals, he's low B1, functional assessment, low B1, vitamin D and B9. As you can see, When you see high blood sugars, low CO2, high NI and GAP, probably needs B1. Did I give it to him? I told him to eat right because we had him on another program to kill off what was trying to kill him. Vitamin D, 29.6, a little bit low. And you can see that it looks like he's B9, possibly a little bit B12 insufficient because he's got high LDH, high or low red blood cells, low hemoglobin, a little bit low hematocrit, a little bit high MCV, high RDW, and a high homocysteine, and a low serum folate. Okay. All right. Folate's not that low, but it would cause a problem there. But that infection, that's a big thing. Adrenal, mixed adrenal pattern, sodium chloride, functionally low, points to low adrenal. Cholesterol and BU on, functionally high, points to high adrenal. That's because he's dehydrated. You'll see this with patients. They'll have like mixed patterns out there. Just use your brain, okay? Use your brain. Say, what would cause this? If something all of a sudden, it's but one thing. Like let's say somebody comes in. They have high fasting insulin of say 35. They have high blood sugar of 106. They're right there. You know they've got a problem. Their triglycerides are 300. And they're like, yeah, I've been, they're maybe 50 pounds overweight, 100 pounds overweight. And they're like, yeah, I'm gradually feeling worse for the last 5 years. You know they got a blood sugar problem. That occurs over time, not like in most cases. Whereas for this person, he's like, yeah, I had this event and all of a sudden I felt horrible. And I felt, again, worse after the second event. And you'll see that with people. I had a kid come in one time and all of a sudden he had crippling anxiety. And I said, when did this start? And he said, Sunday. And so I was like, infection. So basically we found that actually he was fighting something off. That's one thing that'll happen. If you're fighting an infection, it can cause inflammation. You get inflammation of your brain and nervous system, you will feel anxiety. Anyway, not all cases, but that's one of the things that can do it. Okay, so we did adrenal. All right, thyroid, his TSH was high, T4 and T3 were within normal limits. Once again, the HPA, hypothalamus pituitary adrenal thyroid axis, is off because he's fighting infection. That will do it. And all these people with chronic adrenal problems, I would say 80% of them have some kind of chronic immune system stress too. Severe liver and kidney stress, we went over that. It's kind of complicated by the fact that his heart was playing a big role in this. And so what is it? Well, we don't need to know the diagnosis because that's not actually how we treat people with nutrition response testing, nutritional blood chemistry. Okay, what I did was I looked at his blood test and I did a nutrition response testing scan on him. And what I found was he had a severe immune system challenge, mainly parasitical. That doesn't necessarily mean he has parasites. His body was acting like that. Okay. Hydration. He was dehydrated. High BUN, high albumin. It's because he was put on water pills and told not to drink water. That'll do it. Cardiovascular health risk. Fasting severe. He has all of them. If we had left it, okay, he would be in severe cardiovascular risk. I don't think he is now. We haven't run all the tests, but I started testing him every week. Wait till you see what happens to KM. Okay, here's what a complete assessment looks like. The patient, and I went over all these. Scary, scary, scary. And, I put down these considerations. I put them down so the patient could see them, but I was focusing on the, when I did the nutrition response testing, the muscle testing scan with him, I found immune stress. That would do everything. I'm like, let's do that and then do proper follow-up. Remember, proper follow-up is each week, or maybe even twice a week if they're really severe. I called him up because I was like, I wanted to tell him, let's see if we can go up to the, okay, outcome of care comparison. He reports feeling better after 4 days. I call him up, and I did not know what to expect. I was like, hey, I didn't know what to lead with, to be honest with you, because I was like, if he feels any worse, he's got to go to the hospital. He could die at any moment. That's how bad he was. And so I called him up. I was like, hey, how are you doing? And he goes, I feel 100 times. I still remember. I feel 100 times better. Did you give me something that was detox? I said, no, I gave you something out that would basically strengthen the immune system against parasitical invaders. And if you look, The reason why I said I want to lab test you each week, now we're testing me every 2 weeks because his progress slowed down, which it would. But if you look, 823, 827, that's 4 days, okay? And look what happened. The primary things that you see improved are up here. That ferritin went from 4,000 to 1,600. That GGT, which is a marker, classically for liver, gallbladder especially, but it can also be for heart and some other things, inflammation, stuff like that. It went from 1,200 to 600. I mean, he's over 50% better on his black and white lab tests in 4 days. That means that you did the right thing, okay? And we started checking each week. Look at that. From 827 to 93, 910, 917, 10-1. These are each 1 week, and I'm going to get another one, I think, this Friday, this upcoming Friday from him. But you can see how his ferritin, okay, because those are the ones, when you see a marker that high, that shows that person is in danger, extreme danger. Went from 4,000 to 1,600. I think that's 900, 700, 500, 400. The next time he'll be in the lab normal range. His GGT went from 1,200 to 600 to 399 to 229 to 142, 67. That'll be within lab normal range next time. His other liver numbers here, they're well within normal range. Also, what's really interesting, remember I said that those blood sugar, that was kind of an artifact because everything else was screwed up. It went from 106 to 96 to 99, 90, 95 to 81. Did I change his diet? Maybe a little bit. I told him not to eat wheat, and I put him on page phase too. But yeah, I actually told him to eat more. His uric acid, which is also kind of a non-specific marker for inflammation, classically look at that in gout, but it could be for other inflammatory problems. But it went from 6.1 to 5.7, 4.3, 4.5, 3.6, 3. It's normal. BUN, I told him to drink a lot of water, went from 32 to 36 to 17, 15, 15, 16. Normal. His creatinine, which is also a marker for kidney, went from 1.42 to 1.5. By the way, I asked him what he did in here. I said, why did some of these go up? He goes, I'm not drinking water. I said, drink water. Dropped down 136, 1.36, 105, 0.88, 0.85. I mean, just stunning improvements. Sodium went from 132 to 135, 141, all normal now. Potassium, normal. Chloride went from 89 to 92. So you can see all these things reversed. How do we reverse them? I put him on a diet and I gave him something for his immune system. Okay? All right. So hopefully that helps. Share this with all your patients. Remember, with what's going on right now, with all of a sudden these people are having all these health challenges, okay? Run the blood work on them, but also do a nutritional response testing, scan on them. You will find the problem. I tell people, I use the blood chemistry, the nutritional blood chemistry, the blood test, to show them what's going wrong and to show them in black and white so they know it's not in their head, okay? And also that they see that we know what's going on. We're communicating the same way that the doctor is, except for the fact that we're adding in the muscle testing so we can actually do something about it. But you also do the proper follow-up. You don't need to do as much follow-up as I did. I usually follow up my patients. I retest them once every 4 months. I did it with him because I knew that if his ferritin, his GGT did not come down, I was going to send him for an emergency visit, okay? But they did. They started coming down. So right now he's consulting with his cardiologist and his general practitioner. We're trying to get him back to full-time work. He says he's fine. He says he does not feel he needs a heart transplant. He doesn't have the follow-up test to prove the cardiologist, but he told me, he said, you know, I can mow my lawn now. And he said his son got into a minor car accident and he took the bumper off himself. He was not able to barely stand up before, and now he's pulling a bumper off a car. He's strong enough. Anyway, so I just wanted to share that with everybody. Hopefully that helps. And if you have any questions, you know, put them down below, and I'll talk to you on the next video. Thanks.